Dr. Bruce MacLaurin. Here we go. How about a nice hand for Dr. Bruce MacLaurin?
Good. Well, thank you very much for the chance to come and speak here today about the study that we're working on in the city of Calgary. It's called Preventing Homelessness, Developing the Homelessness Asset and Risk Assessment Tool. The HEART tool is how we're going to be referring to it. We have got a wonderful research team that we're working with. In total, everybody has got an interest in one substantive area of homelessness. So for example, I'm much more involved in working with youth homelessness. Leslie Tuddy is working in homelessness and domestic violence. Catherine Bradshaw is really running the whole gamut. Kathy and Jeanette, Wagemaker, everybody has a different interest area, and they're really focused on really understanding what kind of drives homelessness in different ways. We want to acknowledge a couple of things. The idea of this research was identified and funded by the Calgary Homeless Foundation, and a couple of people in particular were driving that whole project. Funding was provided initially by the Calgary Homeless Foundation, but later funding was provided by the REAP3 research group that has been presenting here this morning. We are in the process of getting some additional funding for a phase 2 of the study that I'll talk about in a little bit later on. And the whole project was administered by Catherine Bradshaw from the Center for Research at the Faculty of Social Work. I'm probably not going to tell anybody anything new. You know this much better than I. Homelessness has become an all too pervasive and visible problem in Canada. As Stephen talked about this morning, however, there's also a huge population of young people, adults, elderly that are at risk of homelessness, that are not actually living in homeless shelters and supported housing, but are at risk of that event happening at some point in their life. And we've, I think, really paid less attention to understanding that process or the trajectory that we need to understand more clearly, and understanding how homelessness might have an impact on other people here in Canada. So one of the real clear points we wanted to look at is how do we define those people that are at risk of becoming homeless at some point in their life, whether they're a youth, an adult, or an elderly person. The HEART tool was designed to identify individuals at risk of homelessness. We really have to test the content validity, the internal consistency, and the feasibility within the Calgary region. Does this actually make sense? This is based on American data. It's based on other Canadian data from other parts of the country. Does it actually relate to the Calgary experience? I guess the next step down the road would be, how does this relate to a Vancouver experience, an Ottawa experience, a Toronto experience? Is it transferable in that way? We also want to assist the service providers in intervening at an earlier stage. I can remember working with many young people that have been involved in child welfare, juvenile justice, children's mental health services over the years, and then meeting many of them 10 years down the road and having a renewed conversation with them at that point in time. Could we have done something different at an earlier stage, 10 years prior? Are there things we could have done that would be more useful for that population at different times? It's information, I think, that we really need to understand more clearly. Project goals and methods. We want to conduct an extensive literature review and really drill into the literature that differentiated a couple of things. We want to differentiate between homeless, between those that are homeless and housed for each of the specific population groups that we wanted to look at. We wanted to look at risk factors, assets, predictors, pathways into homelessness, not just in the published literature, in the peer-reviewed literature, but also in the gray literature. We're finding so many things that are really tucked away in research that are probably not accessible to many of the mainframe searches. We wanted to look at homelessness across the lifespan, from earliest points of entry to those people that are farther along the age span. And we wanted to include both structural and individual factors, so not just the factors of poverty and the impact of housing, but also the individual factors that people are facing and running into on a daily basis. How does that interplay with each other? So we identified a number of different subgroups, and again, there's always a problem when we start deconstructing this, because by deconstructing it, we are missing important elements. However, there's a fair amount of overlap between all of these groups. Number one was the whole issue of mental health and substance abuse. It was, fairly pervasive through most of the groups that we looked at. But the youth experience was fairly different from some of the other populations that we're looking at. Women, especially those people that have experienced some type of domestic violence, was another group that we wanted to focus on. Newcomers to Canada and the immigrant population, the Aboriginal and First Nation populations, and also older adults. So the flip was, the next step was really looking at common factors that differentiated housing, or those that are housed from non-housed across the subgroups. So in our review of the literature for youth, for example, what are the differences for youth populations for those kids that are housed versus not housed? How do we understand that difference? And we identified some broad categories that need to be involved in the entire screening tool that we looked at. So we developed a tool that was then completed by, I think at this point in time, it's been completed by about 750 individuals in Calgary. They completed it on laptop computers that were set up in community-based agencies. They were filling it out on an online questionnaire. And what we attempted to do was to have all of this set up and capturing all the information that we wanted to in one questionnaire with a number of additional questionnaires that were tacked on. I'll come to that in a bit. We wanted to screen about housing, about their current housing status, risk of eviction. What are some of the risk concerns for them in the place where they're living at this point in time? We're not interviewing or doing a questionnaire with people that are currently homeless, only those individuals that were at risk of homelessness. We wanted to look at the level of safety within the location that they're living at that time, and the affordability. What happens if they lose a job? What happens if the rent goes up? Is that going to have an impact on where they're living in the short term? We wanted to look at housing stability, the number of times that they've moved in the past, over the last 12 months. Are they staying with friends? Is there availability of subsidized Support 8 housing in the area that they could access if something happened for themselves in the near future? Have there been moves due to conflict in their living situations? Have they had conflict with their peers, friends, and extended support systems? Do they have a history of homelessness? And how does that tie into the current issue? And do they also have a history of youth homelessness years prior to that point? We wanted to look at housing transitions that looked at a history of mental health or addictions facilities. Have they been involved in these? Did they spend time in hospital medical settings during the past 5 years, or provincial or federal correctional settings? Most importantly, we wanted to find out for each one of these living situations, did they experience stable housing following discharge? When they were being discharged from an adolescent correctional setting, for example, were they discharged to the street, or were they discharged to family or to a home that was set up for them within expanded services? And also, have they had a recent move to Canada? Income and education, we looked at employment status, level of concern, stability of finances, income. And again, this is stuff that you know better than I, so I won't go through it in great length. Level of social support, identified a number of different specifics that would look at social support. And what happens when you lose a job? You need, everybody talks about the example when you run out of funds, the rent's gone up, who are you going to phone for help? Everybody needs somebody with that. Are you living with children under the age of 18? Is that yet another risk factor that you're dealing with? And then we began to look at risk groups. And within that group, we'd look at age and sex and cultural background, recent immigration and refugee status, physical and mental health concerns, gambling concerns, and identified concerns with alcohol, substance abuse, and medical prescriptions. Each of these will be specified in a set series of questions, and what we're using this as then a basis for whether kind of the predictive validity of anticipating whether somebody might become homeless over time.